Good morning, beautiful people. It's so wonderful to see you. Today I want to talk about something close to my heart, which is fertilization therapy or infertility affects a lot of people. For example, people with Turner syndrome, like me. But it's wonderful that today we can get a lot of help. It gives a lot of people hope. So it affects both men and women, of course, and it affects about every six people. So it affects a lot of couples, and there are a few different treatment options. For example, the first one is ovulation-induced medications. It's often the first step when you don't know exactly what's wrong, and then you just use your natural cycle and get some extra help with the fertilization. Sometimes people or doctors can't find what's wrong, but people aren't getting pregnant even though there's nothing that they find wrong. And then there's also intrauterine insemination, which is when you clean the sperm and use it after that. And then there's in vitro fertilization, and that is when you put the egg and mix it with the sperm to the woman. And of course there's also donor options, which for example in my case I will be doing. You can use donor eggs and donor sperm, which is becoming more common, for example for people who are single but want children. And it's interesting that back in the days that wasn't socially acceptable, not really. Like, for example, for the president of Iceland, when she wanted to have a child for herself, that wasn't taken very well, as it was just. But yeah, back to the point of what I was saying. Then there's also surrogacy, where you let someone else carry the baby for you, which is in some places legal, and it can cause, it can be a bit complicated for when you can, example, connect to the baby and have feelings maybe when you bond with it. But for example in Iceland that is illegal. And then there's also fertility preservation, which is good when you want to wait a bit but you want your eggs to be, for example, not too old, or your sperm. And it's also good when you're going through some health, you have to go through surgeries, or like if you have cancer or something, and you can wait and you still have eggs that you can use later. So these treatments of course can be expensive, but in my opinion it's worth it. But it also takes a toll mentally and physically. You can't do that. In my opinion, it's a miracle that you can do this, and the birth of a new life is a miracle. So thank you for listening, and I hope to see you soon. Hope you enjoyed it.